Hello and welcome to Inside Edition to discuss national, regional and international issues in depth. The government of Bahrain is fully committed to the policy of all residents in the country enjoy the right to access comprehensive health care. This implies a determination to provide an integrated, preventative and curative health service through a network of primary, secondary and tertiary health care facilities. The technical and financial responsibility for providing this care lies mainly with the Ministry of Health in coordination with other ministries, private sector and the community. In line with Bahrain's economical vision of 2030, the Ministry of Health continues exerting tremendous efforts in tackling the major challenges faced by the health sector, focusing on preventative services and health promotion programs through encouraging community partnership and self-care principles, as well as seeking to provide high-quality health care according to best international standards. For more about the ministry's achievements, challenges and future plans, we are joined by the Undersecretary of the Ministry of Health, Dr. وليد المانع. Welcome back. Joining us in the studio is Dr. وليد المانع. Thank you very much for being with us and answering some of our questions today. Doctor, first off, we would like to congratulate you on winning the United Nations Interagency Task Force Award in recognition of the Ministry of Health's outstanding contribution to achieving Sustainable Development Goals related to non-communicable diseases. What can you tell us about this award, the procedures that were taken in order to choose the winner of this award, and of course what this means to our ministry and to our country?
Well, first of all, thank you, Sarah, for being here in this in this program. And to start, if you allow me, I just want to express my great gratitude to our leaders in Bahrain, His Majesty the King, His Highness the Prime Minister, His Highness the Crown Prince. Yes. And also I just want to thank all the population there in Bahrain, all the people in our committee, which they really help us a lot, mainly, and getting more aware about the diseases. Yes. And I just want to thank also the Ministry of Health, the top of the Minister of Health, and all my colleagues in the Ministry of Health for their efforts. This continuous support from the leaders until actually the one from our population, it's really reflected to our award. Yes. That we reached the success because of them. Yes. I will just admit that. Yes. First, talking about this award, I just want to the UN interagencies. They formed a task force, which was in 2013. Yeah. And actually there was also declaration, high political declaration in 2011 for prevention and control of NCDs. NCDs stands for non-communicable diseases. Yes. Before actually backward that they have communicable diseases more, but now it's almost 70% of our budget will be allocated for the chronic diseases and non-communicable diseases. Yes. What happened with that task force? They have like a criteria, and they put like an evaluation investigation for the countries whom they achieve in the prevention and controlling of NCDs. Yes. They had a visit to Bahrain in 2017, and they were really impressed about this visit. They found, let us say, very comprehensive system that will control NCD in Bahrain. Yes. First of all, that we have on the national level, we have the committee which is for the NCD committees with all the concerns ministers, not only just ministries, it's not only just for Ministry of Health, and even for some of the NGOs. And we are involving all the concerns people in Bahrain about this NCDs. And then from that committee, you will find also some rules there in the country. For example, in primary health care, it's really in Bahrain very advanced, and we are feeling very proud about it. It is a role model, and they found that they have all the specialized doctors as for diabetes, for hypertension, cardiac problems. They were there in the health centers. Yeah. And then they relate some of the laws in Bahrain, and they see that there are some of the laws which is, for example, the law of public health, and there are some decisions which were made, like for the tobacco, 100% of selective tax on tobacco. And for the energy drinks, 100%. Yes. And then we have the labeling also for the smoking products. Yes. And also 50% on the carbonated drinks, or the soft drinks they call it. So they found that there are some rules in the country. There are committee on the national level. Yes. And we have our indicators for the NCDs, which is very well registered, very well controlled and monitored. And the management of the health centers, all of these, it really was reflected. Also, the other thing, the awareness about from our population.
Yes.
There are some programs from Ministry of Health. It's community-based.
Yes.
Something which is called Protect Your Heart.
Yes.
We start with this program to go for the population and their community rather than to come to the health center. So, to the ministries, to the malls, to the clubs.
Yes.
We are going to even some of the shopping, it's not only just the malls, even the small shopping centers. We want to reach them, even the schools. We have actually very well advanced school health in Bahrain. So we reach the population there, and there, let us say, a place of staying, and we call this program as Protect Your Heart, but it have many factors actually to control. Lifestyle changing, smoking, obesity, many, let us say, factors that will lead to NCDs.
Yes.
Well, I think this all information,
yeah.
Which was very well, as I mentioned, it was registered and documented. They found, as Ministry of Health, will be recognized, very well recognized on the international actually level to have this award.
Yes.
And this award was also presented to other, let us say, parties, but not for a ministry, sorry.
True.
It's maybe for like a smaller program or individuals who they take care of something. But as a system of Ministry of Health, as a system which is on a national level, they have this this support, this continuous, let us say, comprehensive services that will be provided by all of them, multi-sectoral, I will just name it. They were impressed about that, and thanks God that the award, they deserve it, Bahrain deserve it, and actually very well.
I mean, that by itself is a great task, because when the Ministry of Health actually does these preventative and awareness campaigns, they actually change, as you said, the mindset of a whole nation. We've seen increase in people going to the gym or doing sports. We've seen increase in better consumption of food, restaurants that are plant-based. We even have better choices of people basically choosing food, and information that comes on Bahrain TV television, on the Arabic and the English channels, as well as the pamphlets that are provided by the Ministry of Health. And on this same factor, I mean, right now we are up against another disease, which is breast cancer month, which is usually October, and the Ministry of Health also has a very big comprehensive program on educating people on early detection of this disease. What can you tell us about that program?
Will you choose a very nice actually example for breast cancer, because it will not be as in the other countries, will not have it there as in Bahrain.
Yes.
For breast cancer, that we started mainly to shift our services from secondary and tertiary to primary health care, and to the community mainly based. So we start by early detection and prevention of the disease. How we did so? The campaigns, as you mentioned, and the raising of the awarenesses mainly for the population about the disease. How could we screen ourselves mainly at home? How the one that could take care of that, and she could early detect mainly the disease by the first signs and symptoms that she will have. So we shift our services even for mammograms, for our professional, or let's say consultant in cancer or surgical consultant. You will find them in the primary based. Why is that? So we found mainly more accessible service for the population. So the woman, for example, if by awareness she found that there are some symptoms which is going wrong with her, and this is like a suspicion of that disease, it will be very easy to go to the health center to get an appointment within 1 or 2 days. She will be reviewed by the consultant even in the primary health care sessions, and at the same time she could have her mammograms will be done as a first screening, and an appointment in the secondary health care for if there is like anything that will be in the signs, from the investigation of mammogram that need further, let us say, diagnosis procedure to be done for the patient.
Yes.
Well, this shifting, you will not find that access for the services in other countries like what will be very easy actually in Bahrain.
Yeah.
So they have maybe they could have like a chat in the community about it, And this chat will have like more awareness about it, and because they will see it in the campaigns and the TVs and in the schools, and even actually in some of the, as I mentioned, the malls and the shopping, everywhere there will be like a population or community-based programs. We will be there as Ministry of Health. So we raise the awareness.
Yeah.
Then we'll provide the services and diagnostic tools in the primary health care with very professional actually people there in primary health care, and then even there will be like small, the access will be better, even the secondary health care as a priority for these diseases. And not only that, breast CA, early detection, prevention, and also screening for complication.
Yeah.
So before they have, even if if they come with the latest stage, still we have the better screening now, and we have even the management, which is very, let us say, pioneer management, which will be found all around the world. You could get it here in Bahrain.
Yeah. It's exactly programs like that that got the Ministry of Health the award. And that's also what we want to really focus on. How does the Ministry of Health contribute to the National 2030 Sustainable Development Goals with these programs and with everything that they are doing and that's upcoming?
Yeah, for the SDGs, or Sustainable mainly Development Goals, they are about 17. Our view here in Bahrain a little bit, it differs. We found these all SDGs will be contributing to the health, directly or indirectly.
Yeah.
I know that number 3 is mainly considering good health and well-being.
Yeah.
Still number 6 may be talking about sanitation or water, let us say clean water.
Yeah.
But all others, like poverty or other financial problems, whatever, they will be indirectly reflected to health, the human health mainly in Bahrain. So as Ministry of Health, they have also, there is actually a national committee for SDG in Bahrain. It's not only just Ministry of Health, but also other ministries that will be encountered for let us say, health being in Bahrain.
Yeah.
Talking about these SDGs, for the goal of good health and well-being, we have indicators. Some of the indicators we are, let us say, we have reached mainly some of the targets since long time. For example, maternity mortality rate, below 5 years mortality rate. We have very good indicators compared to to the region, even actually for worldwide.
Yeah.
For all the indicators, we have set an action plan.
Yeah.
So we assess ourselves today, and we plan, let us say, until 2030, and we have actually to get the target for every single disease, for every single, let us say, indicator. You will find someone who is responsible for this indicator.
Yeah.
And what will be have to be, let us say, done by Ministry of Health or other, let us say, ministries or the NGOs in the country or even the population awareness. Because all of them, they will contribute in that health in our country. So yes, SDG, it is something, as I mentioned, it is directly or indirectly will be reflected to our health. And Ministry of Health have given the priority mainly for the SDG, especially for number 3, for all the indicators which are there. Yeah. I will just give like an example that Bahrain even, some of the indicators were there before, let us say, 20 years or 25 years. I will give like one example about it. For the maternity, for example, the mortality rate, it was high in Bahrain.
Yes.
Let us say in early 40s.
Okay.
And the plan at that time is that to have to establish mainly a maternity hospital.
Yes. Because
they found that maternity problems, it's really something that have to be taken care of. So the first hospital in Bahrain, which is Salmani Medical Complex now, it was called Salmani Hospital because it's changed Salmani Hospital to Center and then the complex.
Yes.
At that time in 1958, the plan is that to have a maternity hospital. Okay. So the priority was for the maternity problems, which was raised here in Bahrain. They put a plan, so we decrease it by more than 10 folds now. Wow. It's really actually, if we compare ourselves in the region, we are more advanced actually about that.
Yes.
So Bahrain actually started for these SDGs, some of the plans, early even before starting with the SDGs. It was started in 2015. True. But we have some of the indicators on program before even actually that to be issued.
Yeah. I mean, you gave an example of the maternity hospital, but there are a lot of things that we also see. I mean, not just Salmania, but the Ministry of Health dealing with all over. I mean, from it is also Diabetes,
Sure.
sickle cell, heart disease, all of these things are being dealt with. There are statistics that are provided by the Ministry of Health, and the ministry deals with them with these programs or different ways. All right. You were mentioning dates, and a date is very important, like 1967. And that's when the ministry or Bahrain joined the World Health Organization. Yeah. Since that time, it's played a major role in implementing the resolutions of this international organizations. That's How do you value the progress of these efforts to this date, knowing that the WHO regulations are not just in our healthcare system, they're also in our training system for our doctors and nurses, they're also in our awareness and preventative programs. So how do you value these efforts?
Well, sorry, actually mentioned about nurses, which is very important. That even actually the strategy for our nurses, which is started very early by Ministry of Health in 1965, after the initiation of the first hospital, which is 1958 as the Al Medical Complex. Well, first of all, that as I mentioned before, that some of the SDGs, some of the indicators were found in Bahrain before. For example, universal health coverage, which they asked for about it now to be targeted until 2030. Already there was actually universal health coverage for Bahrainis, and even actually for residents in Bahrain.
Way before that.
Way before that. It started to about 70 years back. And for some actually of the, for example, if you put like life expectancy in Bahrain, we just want to measure ourselves. Are we actually in the right track?
Yeah.
We just want to assess our, let us say, health system. Is it doing its best? 70 years back, the life expectancy in Bahrain doesn't reach more than 63 years.
No.
So it's only just 63 years. And now, in 2015, actually, it reached about 76. Women always actually more than that. They go for about 78. But in general, as a mean, it's about 76 reach actually in Bahrain. Okay. So life expectancy, they found this indicator as actually a very good actually indicator to see in general mainly. Are we doing, let us say, as I mentioned, our best? Minister of Health and other, let us say, concerns about the health well-being in Bahrain? Yes, we are doing our best. And even actually for the primary health care, now you could find one of the indicators that they have more access, let us say, to the services.
Yes.
As I mentioned, to shift the accessibility to primary health care, to increase the number of health centers in Bahrain.
Yeah.
We reached about now 28. We actually built about 10 maybe health centers within like 10 years, almost like one health center every year like that. So this change with this number make more accessible services for the population of Bahrain. Yeah. And we have the model of primary health care centers. Yeah. That's about 65 years now, or more than that. Yeah. Which is actually before the WHO Al-Mata declaration in 1978 regarding the primary health care. Okay. So Bahrain even actually beyond that number.
Yeah, and for the people that don't know this, I'm just going to if you can elaborate on this, when it actually comes to the healthcare system and how patients are treated in the healthcare system, the actual hierarchy is that the patient should first go to the primary healthcare center, and the primary healthcare center have the professionals that will direct him to the correct place or where he will get the best help. And Bahrain has basically magnificent, it is excellent when it comes to primary health care because of the doctors, because of the staffing that's inside, because of the technology used, and because of, as you said, how many healthcare centers are there, and they're still being opened. I mean, we've had a couple of degrees recently about new healthcare centers.
Actually, we are very well recognized by the WHO that you are very pioneer, and it is really actually a role model for all the worldwide as a Bahrain as a model for primary health care. Yes. And we receive many invitations from other countries. Just they want to know about our experience and Bahrain and how it was done. Yeah. Just to give you like, they have to be aware that the health centers usually, you have the GPs in it, in other words. Yes. Let us say it will be like a GP and very basic investigation. Yes. And the treatment will be very, very limited. Yes. In Bahrain, we have the type A health centers that you will find a consultant in the health center. Yes. There will be a consultant family physician. Some of the consultants from other specialized departments, they will come to health centers even to see the patient, like for example, dermatology, breast cancer, as I mentioned. Yes. Some of them, they will come for cardiac problem or orthopedic, even actually that we have like some of these programs. diabetic patient, hypertensive patient, cardiac problems, even for for maternity care, for vaccination, for screening of children, it will be done in the health center. All the investigation like a lab, which is the major CBCs, biochemistries, whatever, they will found it in the health center. X-rays and investigation will be done also in the health center.
Exactly.
So just like a complete circuit of health services.
Yes.
So they don't have actually to go to the hospital to get the treatment. Especially for the NCDs, we really actually care about the prevention and early detection, which will be done in the base, mainly in the health centers. So concentrating on primary health care, which is also now, it is really one of the major targets for all the countries. To shift some of the countries, they say that we want to close some of the hospitals and we want to open health centers instead. It's a right actually decision. It's not something wrong at all. So we have this infrastructure. We're very lucky about having such services as a primary health care.
Yes, and it's not a bad thing that people don't, or that the healthcare professionals want to close down hospitals. We know that hospitals, no matter how magnificent, big, clean they are, when having so many patients at the same time in one place, a person tends to get exposed to other sicknesses. But healthcare centers, they give you the initial diagnosis, you get your treatment in the hospital, and then you get your follow-up. And especially for chronic diseases, in your local healthcare center, it cuts from your, it will cut your time, better distribution of the patient's time, better medical access, as well as financially, it's much better for the patients going to these areas. In performing its role, the Ministry of Health collaborated with a lot of official and private institutions. These cooperations, as you mentioned before, we are talking about community, private sector, we're talking about other ministries. How do you value these cooperations? How important are they for the Ministry of Health to basically get their message out?
Well, how important? By evidence, actually. They found in some of the studies that Ministry of Health will not do more than 30% of taking care of such patients, or let us say to tackle the NCDs in the country. So 30%, 70% will come from where? It will come actually from other concerned ministries, and I will give example for that. And from the NGOs and from the community. For example, if we decided as one of the indicators in Bahrain that you will have, if you want to get better, one of the factors to change your lifestyle for physical exercises. So you have to practice physical exercises, and they found that it will not be less than, let's say, 3 hours per week or whatever indicator that we have to strict on. Okay, we will raise this awareness, but who will take it furthermore? So we have a Ministry of Education. They have also to educate mainly the students that this is a very important issue and will be linked actually to your health well-being. So the role of Minister of Education also to raise this awareness and to have the programs for physical mainly exercises which will be done. Other ministries, like we have Ministry of Youth now, and they are having also they have very good actually program. When also they have created a sport day in Bahrain, which is very actually well recognized worldwide. And you know, it's really reflected that also this ministry, they have also the rule of getting all, let us say, the population, the youth people, to have exercise and a better way, how they will change it, what will be reflected to their, let us say, health. We'll come to the NGOs. Okay, the NGOs, some of the NGOs are concerned with diabetic patients. Some of them, they will have like advocacy for cardiac problems, for sickle cell disease problems. Okay, how it will be reflected as an NGO? How will you find the physical, let us say, activity and exercise and what you are doing? So they have also the role. They will come to the community. The community by itself, by the awareness, by chatting with other peoples, using now social media. You know, but social media, they have to take care about the information which will be there. It have to be a right source for this information, and we could provide this source of information for Ministry of Health. So this link, it is governmental, non-governmental, and even for the community-based. They will share all of these mainly to have better, let us say, life, to have a good health and also well-being, like say, a good program. So NCDs, it's not only just counted to Ministry of Health, not at all. And as I mentioned, it's about we are doing our 30%, and hopefully we are doing better than that, as much as we could. But there are some other ministries, other governmental, other organizations, the NGOs, and the community. They will have the awareness. Yours about the, if you allow me, that you were talking about the hospital. Now, mainly the concept is the home-based treatment rather than hospital-based treatment. We know the hospital will be linked with other problems. It's not only just the social and financial problems that will be linked with it, but even the health problems. For example, acquired infection, it was very well known in all the hospitals that acquired infection will be whenever you have stayed to the hospital. More, let us say, than 3 days or 4 days, you will get like you're expected to have infection by 4 folds or 5 folds.
Doctor, this is a global thing. It's not just in Bahrain. Globally.
It is. And everywhere. So what they found that the concept, they have to change it. Okay, if we could get the patient stayed in the hospital for less days, it will be better actually for their health. If we provide this treatment in the primary health care, if we provide it at home, if we provide it as a daycare. So you found that some of the surgeries, major surgeries before, it took about 4 to 10 days. Now it will take 1 day only for the procedure. It will be done. It will go out. So this awareness, it's really the population here in Bahrain, the awareness of the community. How will they tackle it? How will they, let us say, consider that it will be reflected to their health? It really will help us. So it's not only just Minister of Health, it's not only just the professionals, they will do their jobs. You are the main target here to doing so, such actually programs is the community. With the governmental and non-governmental.
And the patient himself or herself, they have an obligation to themselves to take care of their health, and whenever they see these signs, they have to come and talk about it. We mentioned it before, October is Breast Cancer Awareness Month, and one thing is with the community, we see a lot in Bahrain streets today. If you go driving around, different malls are providing mammogram tests, they're providing initial testing for these, and people should take the opportunity to have such awarenesses, and as you said, make sure that these are legitimate places to go to through the Ministry of Health's website, and then actually utilize this in order to get the information or get tested for whatever it is, even if they don't do. What is your comment on these programs that are provided?
By evidence, actually, that we have it by, I don't have the statistics now, but I just want to assure you that this awareness was reflected for the early detection of such patients. And it's really saving lives. It's really saving lives. Because early detection of the disease, the treatment will be very easy, and they could actually live long without any problems. So this awareness, we have it by statistics, what was the number, let us say, before, and what is the number after these campaigns, and the awareness session which is done by the community. So this is like a community-based program. Which have, I think, it will count more than 60% of the management or the prevention of the disease. So yes, if we go to our, let us say, researches, we will find that.
Bahrain, and specifically the Ministry of Health, has a lot of cooperations and outreach activities with the international community. How does the Ministry of Health benefit from its international outreach activity and cooperation with the global health institutions in terms of training and expertise, and even like providing medical care for the patients with specific sicknesses?
Well, actually, we have a collaboration, or strong, let us say, collaboration with different agencies and organizations worldwide. WHO, which is considered for health, UNICEF, UNDP, UNESCO now, all the interagencies. And we have actually a good relation with even the universities worldwide. Our professionals, they graduated from different universities worldwide, and they have the relation until now, and they are also attending some of the symposiums, some of the conferences, which will be related to health sector. These organizations, they recognize Bahrain, let us say, as an accredited place for their training. For example, now RCSI, or the Royal College of Surgeons, would they train their students here in Bahrain, so in King Hamad or in Salmania, as a Ministry of Health, or the hospitals, major hospitals, governmental hospitals in Bahrain. Arab board, Saudi board, and we have the boards, even actually we have the UK boards before. The Canadian, we have the Canadian accreditation. In Salmania, we have the Canadian accreditation with the diamond mainly, and the prime health care, and the gold actually for Salmania Big Complex. Why is that recognition? Why do we have this accreditation? Because there are some of the standards, and we reached the standards and a very actually well grades, as I mentioned. So Bahrain, because of the very well, let us say, developed or will develop maybe infrastructure for primary healthcare, for secondary healthcare. So we get the recognition from universities or from organizations worldwide, and even from some of the visiting doctors. Now the visiting doctors, they will come to Bahrain and they will do their surgeries here in the country. Because they were very comfortable about the team who will take care of the patients during the surgery, really to say for diagnosis, during the surgery, even actually after the surgeries. So this recognition, because we have actually very well established infrastructure as hospitals and even actually in the primary healthcare. So how could we collaborate mainly in the training? We are still actually sending our doctors, our professionals outside Bahrain. Even actually we have some internal now the STRB mainly and FBRB, the programs for training for specialized doctors that will be here in Bahrain. We will not send our doctors outside because it is an accredited place mainly to have this training. And I think this is really actually an added value for us.
Not only are your experts sent out for further training, but they're also sent out to give further training in things that Bahrain has specialized in over the years and things that Bahrain has so much expertise. Can you tell us about the programs where basically people are sent out to educate other facilities or countries internationally?
Well, in the region actually we are the first mainly country for the nursing program. And the nursing program here in Bahrain, the percentage is less than, let's say in 1965, we are less than 2% maybe are Bahrainis. And now we reached to about 65% or more than that, 67%. Compared to, let's say, to the Gulf area, maybe they will not reach to about 40% from nursing from the same nationality. So even compared to other countries in Europe or other countries, it is very difficult to have nurses from the same country. How it was that developed, as I mentioned, there was a strategy and training program started more than 50 years in Bahrain with a college, with a hospital that would be combining and graduating these nurses all these years. So we reached to that standard, also to reach to that percentage. What happened, they get actually from our experience in the Gulf area, in the region, how we did it. And there are some of the established, let us say, nursing program was from Bahrain. So Bahrain programs is one of the examples that really until now we are receiving some invitations from our professionals to come or to attend in the region to mainly to know how they will improve the services for nurses for training and even for the management. Other than that is the primary health care. The model of primary health care, we are receiving a lot. And we have actually visitors from all around the world to Bahrain. They just want to review what is the primary health care setting in Bahrain and how could it will be reflected to their programs there in their countries. So primary health care and nursing, I think that we are pioneer in that, and we extend our experiences to the region about it.
Yes, that's amazing. The Ministry of Health has also or is keen to increase the use of technology when it comes to its healthcare services. What can you tell us more about the ministry's efforts in the fields and how their success is being assessed, especially with the new technologies that are coming out every single year, even shorter period of time?
That's right. Well, you cannot separate now health from technology. And it's really accelerating very fast. Even actually, if you now, for example, talking about X-rays from analog to digital, then MRI, then we have the CT scan, then we have actually other than CT scan, which will be in every single year. It will be more advanced and advanced for diagnosis, even for management. Now you will go for GPS for the brain, and you will do the surgery very easily. You know, they make life easy actually for the doctor and professional by technology. So how we are, let us say, assess ourselves about using such technology, and we have to let us say go with them in the future plan. Every single advice that will be in need, Bahrain, they will provide it to our professionals. And other than that, the electronic mainly file, all the electronic, let us say, history taking, you know, the filing mainly, a clerking job, all to be paperless. And now in primary healthcare, it is all paperless. We have the electronic file there in primary healthcare, and we have it also in Salmani Medical Complex, almost 99%, I will say. And there's also in the psychiatric hospital, some of the peripheral hospital. In Bahrain, other hospitals like BDF Hospital or King Hamad Hospital, they were since long time, fully actually electronic. So how could we also, in the future, gather this technology? There will be like a medical record for all the Bahrainis or all the citizens of Bahrain.
Yes.
and the government and even actually the private sector.
Yes.
And that's what we are looking for. We already started in that, and this is the Supreme Council of Health. They have that program.
Yeah.
They will link all the governmental hospitals and even the private hospitals. So anyone here in Bahrain, living in Bahrain, they could access the information about him. Okay, he was done, let us say, CT scan this hospital. I will not repeat it for him.
Yeah.
This management. So I have to be aware about what was medication which was taken. It really will. It will help mainly management. It will really actually make easy. Technology, always whenever actually it's used in a good way, it will be reflected to the management.
Yes.
So medical equipment which will be used at an advanced technology, we are up to date for it.
Yes.
And the government is very actually keen to support it, as I mentioned before. They are really actually supporting that, such thing. And you will find it. Yeah, for example, if you go to some of the devices in Bahrain, it counts for a lot actually of money, millions. It's not even one device could cost us about 1 million, more than that.
Yes.
But the government will support us in that because they really actually are caring of Bahrainis, and they are caring about the residents here in the country.
When it comes to healthcare, one of our major things that a person always learns in healthcare is planning the treatment of a patient as is the most important aspect, and technology helps with that planning mechanism where you plan the surgery pathway, where you plan the treatment pathway, and so on. As you mentioned, the program that basically brings together the patient's file, this helps because people always don't realize that patients don't have a healthcare background, so they don't know what medications they're taking, they don't know if it's contraindicated or not. Sure. So systems like this help even to save a lot of lives and save them their medical dignity when if you can look at it that way, where the medication might do a little bit more harm than it does good when it's put with other medications or other foods. So a healthcare system like that will prevent so many diseases and so many complications. Do you see it that way as well?
Yeah, sure.
Yeah.
Actually, I'm talking about the files, for example, and also now we have like application even for the patient.
Yeah.
Management of a patient, it will be, there are types of management. For example, if you want to choose it from parent to child, or from friend to friend, or even actually the patient could be the parent and the doctor will be the child.
Yes.
Which we will not support that. But whenever you are sharing the management with the patient, you have to share with him the information.
Yes.
And he have to get it actually in a good source, which is they have to be. We have to be assured about the information that he will receive. Now we are talking about applications everywhere. We are talking about social media, the internet. It is the time of data. It's the time of information. Yeah. And the technology in that, yes, we have to go with that. And if you find even Ministry of Health, by the way, we received awards, several awards from a government. We are maybe the Ministry of Health, maybe one of the. We have it more than I think that 3 or 4 times, and this year also we have we were awarded by the government.
Yes, we thought.
Because we realized that this technology have to be better utilized, and mainly helping the professionals, even the patient, to do their job.
Yeah. Well, Doctor, we've gotten almost to the end of our show. If we keep on talking about how much the Ministry of Health is affecting the lives of the people and the residents, everybody on Bahrain is affected by these services that are provided and so on. What is there, like a last word that you can tell us about the future plans of the Ministry of Health to improve it even further when it comes to the treatment of patients?
Well, actually, talking about the strategies which we have as Ministry of Health, it is there. It is very, very well written and monitored and very well developed, let us say, and it is connected by all concerned the other ministries and even the national ones. But they have to know that health is not only just for Ministry of Health. Well, health actually it is something that will concern everywhere, every single, let us say, person in Bahrain.
Yes.
So as I mentioned about the community mainly role, the governmental role, non-governmental role, we have to share, all of us, to complete each other, to have a better, let us say, health, and to have a well-being human in this country. And I think this collaboration, it will be the plan for us in the future.
Yes.
So it is one of the goals which is there in our strategy, but I think it is one of the major goals in this strategy. Anything will be done by the community, the governmental and non-governmental. Even the Ministry of Health will be reflected to our health. Yes. And by this concept, I think if everyone in Bahrain will have like a responsibility for health, and this responsibility, we could actually lead you for this responsibility. We could just give you like a terms of references.
Yes.
We could make it, let us say, easy for you. But you have to share with us. You have to be responsible for your health, first of all. And then caring of yourself will help us in caring about you.
Yes. Well, at the end of this show, and in focusing on the words that Dr. وليد has mentioned to us, the Ministry of Health has a very comprehensive website with all the information that anybody needs in any kind of specialty, even when it comes to the event and the awareness and the preventative measures that are taken. There is a section where you can contact, if you have certain questions, there is always an open line from the Ministry of Health to relate your information or have these questions or even report things that you want to report. And also the social media sites and accounts of the Ministry of Health provide the information about the events and about the things that are important to each single individual separately than others. Some people might want to see the diabetes events, some people want the sickle cell events. All of these events are provided by the Ministry of Health on their website and their social media event. Thank you very much, Dr. وليد المانع, for being with us and answering all of our questions. And we would also like to thank you, dear viewers, for watching, and see you next week in another episode of Inside Edition.